So we're gonna, I talked to Steve earlier and so he's gonna take roll call, and you could do your introduction real quickly after roll call. That just makes it orderly and we get through the meeting a little quicker. So with that, Steve, I'll turn it over to you to take roll call.
Okay, copy. So I'm going to go through the members of EMCC, alternates that cover the positions that the members not here, then any alternates whose members are here, and then members of the general public. So Tina Nieto.
I'm president and I represent Law Chiefs.
Sam Klemek.
Present, Salinas Fire Department, representing the Monterey County Fire Chiefs.
Jim Landborg.
Present, representing BLS Fire.
Thank you. Harry Robbins.
Representing Citizens Peninsula.
Thank you. Jody Schaefer. Luz Garcia. Paul Wood. Nick Greenson.
The community physician representative.
Greta Steinbrunner. Carla Spencer.
Good morning, Carla Spencer, representing the hospital administration.
John Anthony.
Present, John Anthony, representing Monterey County Parks Department.
Michael Esslinger.
Good morning, present, representing the county ambulance provider.
Okay, any other alternate members? Roger Reinhardt, Cheryl Getz, Ben Harvey, Dr. Hawthorne, Joe Cafaro, Keith Boyd, Andy Smith.
Hello, Joe Cafaro, representing hospital administration. Thank you.
Thank you, Joe.
Cheryl Getz here.
Thank you, Cheryl. Any other alternates that I just called? Great, thank you very much. For the rest of the public, feel free to announce your presence. It is not required.
Scott Houchin, Salinas Fire.
Evans Panholzer, Monterey Fire.
Dave Cross, Monterey County Regional Fire.
I'm sorry, there's
That
two.
was Jeff Horner.
Okay,
Ben Hitchcock, AMR Monterey.
Sandra Flores, AMR Communications.
Bill Hiller, AMR.
And did we get Dave Craddock? I think he got stepped on.
yeah.
Lee Magosti, Emergency Communications.
Oh, thank you. I'm sorry, our ex officio members, Teresa Rios.
Teresa Rios, EMS Agency.
Gary Millay. And Leanne, I got you. Thank you. Any other members of the public? Great, thank you.
Devin Hagen.
Oh, EMS agency staff. Oh, and Devin, got you. Steve Brooks, EMS agency staff.
Really Hernandez, EMS Agency.
Deborah Hopgood, EMS Agency.
Roxanne, we couldn't hear you, but Roxanne, super sad. Super sad. Anybody else?
We see you, Roxanne.
I was double muted.
Great. Is there anybody who I did not acknowledge? All right, we do have a quorum.
All right, with that, we'll move to public comment. Is there anybody from the public that'd like to make a comment not to exceed 3 minutes? They can do so on anything that's not, we don't already have on the agenda to take action on. Steve, I don't see anything, so we'll move on to recognition. You know, as the chair, I just want to just say that Michael really was dedicated to the people of Monterey County. And I just want to thank him on behalf of the entire board for his years of service and, you know, sitting on not just this board, but many different boards when you're part of this board. Chief, good luck out there, and I'm going to open it up to comments from the board. Thank you.
I'll address this to the board and also to Mike since he's present. It's been a pleasure over the years to work with Michael Krukoides in many capacities. But like Tina mentioned, I deeply appreciate his commitment to people of the county and the attention and the direction he has helped provide to pre-hospital care across the entire spectrum. It is always a pleasure to work with a true professional.
This is Carla Spencer. I want to ditto what Tina and Harry have said and just thank you, Mike. We're so grateful for all of the work that you've done for our community and your passion for what you do and compassion for the people. Thanks so much.
Yeah, Mike, if I can also. Oh, go ahead. You go ahead.
Chief Krukoides, this is Teresa. I want to thank you for all of your contributions. When I read just how many, what a long career you have had in your commitment, it shows your commitment to this community. Thank you for your contribution to EMS. I really appreciate it. You challenged us, and I appreciate that because that's how we grow. So the best to you in your retirement, and thank you again for all your contributions.
Anybody else? Because I just want to, the other Mike. Go ahead, Mike.
Yeah, I also wanted to comment, Mike, you know, he's always been such an incredible crusader for the patient and, you know, for so many years working together, he's sorely going to be missed for certain. You know, I wish you all the best and thank you for all the contributions you've made for us and always being such a great advocate. So thank you.
And then Dave, you have comments?
Yeah, I just wanted to say thanks to, let me take a moment and publicly thank Chief Krukoides for all that he's done for our organization and also the community for the benefit of the people who live and work in this area. He's done a lot for our agency. He saw us going from first responders to have an advanced life support paramedic program and ran the transport program as well. And I just wanted to publicly thank Chief Krukoides for all that he did for us. So appreciate that.
And then for the rest of the board, one thing I want to add about Mike is that when I first joined the board, we were dealing with some controversial issues and Mike pulled me aside right away and said, hey, the police better be with us. And so we've worked real well with fire since then. So Mike, that's because of you, because I remember that. Hey, come here. I need to talk to you, Chief Nieto. So thank you for really caring about the community. So with that, Mike, we're going to turn the mic over to you. So.
Thank you. Just a little funny story, 13 days in retirement, how quickly you lose track of time. Yesterday at 10:25, I thought it was the EMCC meeting. So, you know, there you go. That's how much I miss Zoom meetings and the EMCC. I was a day early. So, but yeah, so that's in perspective. Thank you. Just real quick, who I really, in my heart this last week, it really hit me when I saw an AMR unit sitting at North Main at 101, and I was with my 14-year-old son and explaining system status. And, you know, it dawns on me, healthcare professionals, it's been a very stressful year or 2 years with COVID, but there's not one healthcare profession that gets done transporting a COVID patient and then goes back and sits in that ambulance, right? Fire folks, we go back to our station. You know, healthcare workers, we can go to the break room. And so really those are the people I think we should thank today is those people working on our ambulances in Monterey County, specifically AMR, that have to deal with those posting locations, and especially 2 years of a pandemic. So that's who I want to thank. And as my time on the EMCC, that's who really I wanted to make sure that they had a voice. And so Chair Nieto, those are my final comments, and Happy New Year to everybody. Thank you.
So, Tina?
Go ahead, Steve.
Before Michael leaves, the the EMS agency really does appreciate his longstanding efforts. As someone who's started in the trenches as an EMT, for a private ambulance provider, many years ago, to work his way up through the ranks of the fire service to leading a very progressive EMS organization and fire department and a district. Chief, retired Michael Arkides certainly deserves a lot of appreciation. So the EMS agency has, and one of the problems of COVID is not able to hand it to somebody in person, but we did create a plaque that we will make sure we get to Michael and to let him know just how much the EMS agency appreciates his dedicated efforts on behalf of EMS, the patient, his district, everything. It's quite a balancing act. And so in appreciation, Michael Arkides, we want to say thank you very much for years of service. And we will figure out a way to get this plaque to you. And we wish you all the best in retirement.
Thank you.
Thank you.
Thank you for that, Steve. Mike, good luck in retirement. So go back to golf. All right. And we're really going to miss him. So, but moving on to past EMCC minutes, we need approval. Can we do them in a batch or do I have to do them separately, Steve?
I would like to make a motion that we approve them all three together to save time.
So there's a motion on the floor to approve November 10th, December 9th, and January 5th.
Second.
Jim seconded, Steve.
Thank you.
Roll call.
All right. Pardon me for a moment while I do. Okay. Roll call. Tina Nieto.
Aye.
Sam Klemick.
Aye.
Jim Lamborg.
Aye.
Harry Robbins.
Aye.
Nick Greenson.
Aye.
Carla Spencer.
Aye.
John Anthony.
Aye.
Michael Esslinger.
Aye.
Unless there's a member that I missed who showed up late, motion carries.
Thank you for that. Moving on to reports, moving on to the MAC report and the EMS Quality Improvement Program highlights. Deborah?
The draft MAC minute meetings from the November meeting are included in your packet. I'll go over some highlights from the recent CQI tag and quality improvement efforts. So as you'll hear when people talk about the policy and protocol cycle, a significant portion of our time and efforts have been devoted to the review and revisions of those drafts recently. We did have meetings of all four of our QI committees in the month of December. The CQI tag meeting was focused on a general overview of the policies and protocol changes, and the TQIC meeting was focused on the trauma protocols in particular. We had good, robust discussions at both of those meetings and have incorporated some changes into our drafts. Our next meeting of TQIC is also going to have a presentation from one of the neurosurgeons at Natividad talking about head trauma and patients on anticoagulant therapy, so we're looking forward to that. We've published our schedule of the 2022 committee meetings. That's out. The Zoom meeting invitations have been distributed as well. We have been working on an agreement with the American Heart Association to obtain some automated access to stroke and STEMI data from our stroke and STEMI centers throughout the county. That agreement was scheduled to go before the Board of Supervisors on January 11th. There was an issue with the agreement itself not being included in the Board of Supervisors agenda packet. So unfortunately, that's going to be delayed until the meeting on January 25th. But we think that's going to be a really good addition to the system. It's going to make the process of obtaining follow-up information a lot easier for our staff and really decrease the burden on hospital staff to provide that information to us as well. So we're looking forward to getting that implemented soon. Another big project has been working to improve the health data exchange process. So we held two meetings in the month of December. Both of those were with ESO, our PCR system provider for our EMS system. We met individually with Natividad Medical Center and discussed expanding the data that they're currently sharing and making some modifications to their practices. And then we held another meeting with representatives from me and ESO, and they are looking at implementing a data exchange program at that facility as well. So we're basically in the queue to move forward with implementation of those two plans. And as soon as we have IT folks from ESO who are available to move forward with that, we'll get that ball rolling. Continuing education wise, we held a meeting to, a continuing education class that was hosted by Dr. Burley, reviewed trauma case studies. We did a lot of work to publicize that out to EMS personnel, including posting it on our website and Facebook, and then emailing all of the EMS providers individually who hold certifications or licenses. We had a really good turnout as a result of that, and we'll continue with some of those practices for our future offerings. So we are looking at continuing those classes into 2022, and we closed out our survey on looking for feedback from the providers on future classes that they're interested in. So we'll use that to inform our classes going forward. We've also worked on base hospital physician training that will be presented to the CQI TAG group at the next meeting. And then the agenda packet has the next meeting dates included in it as well. That's all the information I have, but I'm happy to answer any questions that anyone might have.
Deborah, I don't see any hands raised, so we'll move on to the operations subcommittee draft minute meetings. Is anybody presenting that, or because I don't see a name?
I think that it was just on there that they're included in the agenda packet.
All right, thank you. So that's included in the agenda packet if you want to take a look at that. Moving on to the EMS agency updates, Teresa.
Thank you, Chief. To start, I wanna start my updates by happily reporting that the amendment to extend the current ambulance service agreement was approved by the board yesterday. The contract was extended until June 30th of 2025. The amendment included a substantial rate adjustment that included the regular annual rate adjustment and an extraordinary rate adjustment to cover a significant wage increase for paramedics, EMTs, and dispatch staff, as well as modifications to various sections of the agreement. There is one section of the agreement that will have a transition. You don't see that in the amendment, but there is a 6-month transition in the implementation of changes to the section related to behavioral health transport. I'm also happy to report that our recruitment for the Management Analyst 3 has been completed. As I mentioned before, we restructured the positions with that position with a goal to strengthen what I call the program services. It used to be more of a financial person. That's my old position, and we really want to make sure that there's good support for the people who do the majority of the work that supports the system. And so Deborah Hopgood, our EMS analyst, has now moved into the position of Management Analyst 3. I'm excited about that, and I hope that you welcome her in her new role, and she is looking forward to working with everybody in her new capacity and accomplishing even more good things. We are in the process of our 2022 policy and protocol update. We just gave Steve just gave a presentation to the MAC committee. We completed the public comment phase. One of the things that we have reported before is that we are looking at different processes and revamping them. This is one of them. This is a big one for us to revamp because it has such an impact on the rest of our stakeholders. We want to lengthen the time that we have for review and other things, but what we focus, the things that we were able to implement during this particular cycle is that we increased the stakeholder input. We extended the public comment period by 1 week, and we took it out of the review of the policies to be done during the holiday season. We held a special meeting with TQIC and CQI TAG. Normally, CQI TAG does see the policies and protocols, but we brought them to TQIC because there were changes to trauma-specific policies and protocols that we felt it merit a review by that subcommittee as well. We also held open meetings via Zoom in December. There were 4 Zoom meetings that we held. So to give not just the people on our regular list an opportunity to comment, but we actually put it on Facebook and our website, and we did a direct mailer to all the EMTs and paramedics in our system, so that to give them also an opportunity to comment. So those who attended expressed positive feedback, and they welcomed those opportunities. So we are looking at incorporating more of that in the 2023 cycle. Our next steps are to develop the training materials and release them early to stakeholders, so they can take them sort of for a test drive and provide us feedback early enough, so that by the time that they are officially released on April 1st, the training materials are clean, and agencies can just focus on doing the training. We are taking notes from the feedback from our experience and incorporating some of the changes, so that when we start the 2023 policy and protocol update cycle, we make more changes. And we will continue to reach out to our stakeholders for feedback and fine tuning as we are making the changes. So we appreciate everybody who has given us feedback on the policies and protocols, and that you have taken the time to review. We really appreciate it. Just a couple of 3 more things. The EMS agency, there was an opportunity to get some reimbursement for those agencies who have provided training for their staff to administer the COVID vaccine. It is not a lot of money, but we did work with our stakeholders who have participated to submit that grant to the state. We are still waiting for that to come in. But any time that we can get an opportunity, we don't see those very often, but we are on the lookout. Anything that we can do to bring back and find more additional resources for the system, we definitely want to do that. We reported before that we were revamping our unusual occurrence report case review. We rolled out the new scoring criteria. We also added, because we have made an emphasis on just culture, we added a scoring for just culture on the tool, so to make sure that it stays consistent. It is 3 scores. You'll see those on the forms. We definitely like your feedback as we start to communicate with the agencies using the new tools. Please do give us your feedback. We wanna fine tune and make sure that this works for everybody. Lastly, we were working on medical alarm activations and response. There was a discussion about unconfirmed medical alarms and responding to those with a higher priority. The agency took a look at those calls. There's a couple of slides, and I think Kimberly will do justice to this since she presented to ops, and if it's okay with everybody, I would like her to share the 2 slides and just give you the update of what the change was made in, what the change that we made in how we came to that conclusion. Kimberly?
I will share my screen.
Thank you.
Okay, can everyone see my screen? Thank you. Okay, so at the November operations subcommittee meeting, this had been discussed several times over the last year, but we ran some data on medical alarm calls. So from January 15th through September 9th of 2021, there were 407 medical alarm calls. I went into the CAD because a lot of this information is in free text to confirm if they were unconfirmed medical alarms or confirmed medical alarms, meaning they had the alarm company or a dispatcher had spoken to somebody on scene that there was an actual medical alarm versus an accidental alarm or something went off haywire with the alarm company signal. And we found over those 407 calls, 248, which accounted for 61%, were unconfirmed. 159, which accounted for 39%, were confirmed. And then on the right hand of the slide, you see a table, and it's talking about medical, the MAC stands for the medical alarm company, the call type that's in the CAD. So the medical alarm confirmed versus the medical alarm unconfirmed, the dispositions of those calls. So specifically, if you look at the medical alarm unconfirmed, those result in no transport 93% of the time. 7% of the time they transported code 2, and less than 1% of the time transported code 3. So it was discussed at the November meeting that this data warranted a change in the response to unconfirmed medical alarm calls. And so as of November, the change, Dr. Burley approved a change that an ambulance would not respond until it was a confirmed medical alarm, or first responders on scene that responded confirmed there was a medical at the scene, and then an ambulance would be dispatched.
Thank you, Kimberly. And we'll be monitoring the data. Even we felt that it was a conservative change that we could make. And anytime that we implement a change, we're going to be watching the data carefully to make sure that the change, it was the right change, because sometimes you don't know until it's in practice. So we'll be monitoring the data, and we can bring a report at a later time. And with that, I'm happy to answer any questions you may have.
Any questions for Teresa? Thank you, Teresa. I don't see any hands. Moving on to Mohawk activities, Deborah.
As you might imagine, the end of December and early January have been a really busy time for the Mohawk. We've seen a huge increase in requests for assistance that have gone along with the increasing number of COVID positive patients. So there is a written report included in your agenda packet. The data included in that is as of January 3rd. I do have some updated data for you that's current as of Monday the 10th during our last set of data reporting meetings. So the test positivity rate has actually increased to 8.9% as of that reporting. There is a lag in the reporting of that data, so it's thought that it's actually quite a bit higher than that based on kind of anecdotal evidence from the local ERs and the numbers that they're seeing. Going along with that, there's been a huge decrease in test availability, which is also probably impacting that number, and then an increase in test turnaround time as well. So all of those are kind of impacting our data that we're seeing come through. Our case rate is up to 47 per 100,000, which is kind of in line with what we've seen during past peaks at this point. We have 52 COVID positive patients hospitalized, 10 of those in the ICU and 7 on ventilators. And then vaccination wise, we're at 80% of our eligible population having received at least 1 dose of the vaccine, and then 71% of those in the population being fully vaccinated. We've had a lot of questions about the different variants. When they're doing genetic sequencing, they're currently at about 80% of the Omicron variant that they're seeing throughout the county, and about the rest of the 20% are Delta variant still. So that's been pretty steady for the last couple weeks, that percentage. Other activities, we did apply to the state for a local optional scope of practice to allow paramedics to vaccinate pediatric patients between the ages of 5 and 12 years old. That was approved, and the process is in place and been distributed to the agencies if they are interested in expanding their scope of practice in that way. We are also pursuing a similar option for our EMTs as well. We've applied to EMSA for that, but unfortunately have not heard back from EMSA at this time with an affirmative to go ahead with that. We submitted that a little while ago, probably about 6 weeks ago or so. So we're continuing to reach out to them, with the last time being last week, seeking that approval, and we're just still waiting to hear back from them with that. We do know that's an important addition for those areas that aren't served by ALS providers, such as our South County, and our BLS agencies down there are anxious to jump in and be able to assist with the vaccination efforts. We've seen a huge increase in requests for supplies and have been fulfilling those orders as they come in for the most part. Our one particular challenge has remained related to testing supplies. They're just simply not available from the state. at this point. So many of the supplies that have been available have been diverted to the Office of Education for distribution to the schools. So another important effort, but that's pulled those resources away from the Mohawk and those sort of distribution plans. So we are still able to fulfill other requests and are happy to do so as they come in. We've been making a significant effort related to monoclonal antibodies and other therapeutics. We've taken over the processes for signing up facilities to be eligible for those, placing the weekly orders and making sure those are distributed as they need to be. The other big change that we've seen has come from EMSA. Along with CDPH, they've instituted a series of twice weekly kind of situational awareness type calls. Those are held with the RDMHSs, our regional representatives, the Mohawks, EMS agency administrators and medical directors. And the goal for those is just to kind of run through some quick data and get a feel for how the situation is throughout the state. As a result of those, we've had to request some data from our partners, our transport agencies and our facilities in particular, for data points that we're not able to compile ourselves. We're able to put together most of them ourselves, but we do need your assistance with those particular data points. If we need your assistance, I have sent out emails asking for that, and hope you'll be able to help us by providing that data so that we can share it and share our situation that's going on in Monterey County with the region and the state. So that's all of the information I have, but I'm happy to answer any questions on Mohawk related stuff.
Does anybody have any questions for Deborah? Deborah, congratulations on your promotion too. Well deserved. So
thank you. I appreciate that.
All right. I don't see any hands, Deborah. So excuse me. Moving on to communications testing, Kimberly.
Thank you, Chief. Let me just share my screen. And can everyone see my screen? Thank you. Okay, so first we have the 800 megahertz disaster medical radio system testing. For October, CHOMP had a 73% compliance response, me had a 90%, Natividad had a 90%, SBMH had a 90%, and AMR conducted the test 100% of the days. In November, CHOMP was at 93%, me was at 69%, Natividad was at 79%, and SVMH was at 69%, and AMR conducted the test 97% of the days. We are reporting the 800 megahertz and the ReadyNet the month after the tests are completed. We're reporting them to the hospital so they see these before the committee meetings. Me advised in October, or after they got their October results, that they were having some technical difficulties with their 800 megahertz radio, some issues with the volume and the mic, and they were referred to County IT to try and resolve the issue so that their compliance would come up. For November's results, SVMH communicated that they had a lot of traveling nurses and some are not familiar on how to work their new radio, and Carrie Campman was going to work with the staff to provide more training as needed and stress the importance of responding to the radio checks. And also Cassie Caldera from Natividad advised that she's going to remind staff of the radio drills in an effort to get Natividad's compliance higher for 800 megahertz. For the ReadyNet, we were only able to report October. ReadyNet was unable to be reported for November because some of the response data was lost inadvertently. We know the test was conducted based on reports that can be run in ReadyNet. So AMR did conduct the test for the drill, but not capture responded. So we wouldn't know who responded to the drills that were sent out. But for October, CHOMP responded 97% of the time, me responded 77%, Natividad 87%, and SVMH 97%, and AMR conducted the drill via ReadyNet 100% of the days. Does anyone have any questions regarding those drills or tests?
Kimberly, I don't see any hands, so thank you for that. We'll move on now to the contract compliance working group. It's back to you.
Thank you. And again, can everyone see my screen? Thank you. Okay, so for contract compliance, for response time compliance by priority, all priorities met or exceeded 90% compliance for the month of October and November, except for priority 1 in November, which was 88%. Response time compliance for green, priority 3 for October was 88%, and in November, priority 1 was 88%, and in November, priority 3 was 89%. AMR dispatch did advise that priority 3's percentage dipped in these months because many calls ambulances that were responding to priority 3 calls were diverted to higher priority calls, which extended the response time for the lower priority, which is priority 3 calls. All other priorities that were reportable met or exceeded 90% compliance. Priorities 5 and 6 in October and priority 6 in November were not reported due to the 100 call rule. For response time compliance for yellow, the only reportable priorities in October were 2 and 3, with which both exceeded 90% compliance. In November, the reportable priorities were priority 1 at 87%, priority 2 at 97%, and priority 3 at 89%. And for response time compliance orange, in October, the only reportable priority was priority 2 at 97%. And in November, the reportable priority was priority 3 at 100%. So EMS dispatch performance, as pretty much across the board, dispatch performance for October and November continues to be well below the 59-second standard. For the medical priority dispatch system performance in October, 69% of calls were EMD'd and 5% were aborted due to help arrived. So they were able to complete, as we've talked about before, they weren't able to finish out the EMD because help arrived before they can finish the call. And in November, 70% of calls were EMD'd and 5% were aborted due to help arrived. And that is all I have. If anyone has any questions.
Anybody have any questions for Kimberly? I don't see any hands or anybody speaking up. So thank you for that report. Moving on now to fire-based providers. Roxanne.
Hi. Hopefully you guys can hear me this time. Okay, so today I will be presenting the Monterey County Regional Fire and Criminal Fire 98th percentile response times, primarily focusing on November and December. That's what's changed. In the upcoming year, we do hope to expand this to include all the fire-based providers, but I'm going to use like the same consistent methodology. So let's skip this slide for now. Beginning with Monterey Regional, the medically related call volume totaled 1,056, which is lower than both 2019 and 2020 for the entire 2021 year. But not by much. In 2019, there was a total of 1,174 calls, and in 2020, there was 1,063. So from 2020 to 2021, just a few calls below. There have been no significant changes in the response times or the 90th percentile response times from month to month throughout 2021. Regional's 90th percentile remained about 15 minutes for an average of 88 calls per month. In November and December, the 90th percentiles were just under the 14-minute mark for each month. With calls within Monterey County Regional Fire District, CAT identified designated response area, call volumes for 2021 was slightly lower again, but in both 2019 by 37 calls and in 2020 by 22 calls, but the 90th percentile response times in 2021 were generally around 14.5 minutes for an average of 56 calls per month. In November, the response time was 13.5 minutes for 69 calls. And in December, it was just under that 14-minute mark again for the 61 calls. Calls outside of regional designated response area, the call volume in 2021 actually increased compared to 2020, but is still lower than the 2019 calls by about 8. The 90th percentile for calls outside of the response area was about 18 minutes for 25 calls in November, and in December, 29 calls with 11 minutes and 54 seconds, 90th percentile. And with this, the call volume is significantly lower. So I would just like to note that the low call volume can lead to unstable statistical interpretation and variations in month-to-month 90th percentile. So keep that in mind. And then now transitioning over to Carmel Fire's ambulance, the medically related call volume totaled to 1,152 in 2021, which is higher than both 2019, which had 1,105 calls, and in 2020 with 945 calls, medically related calls, that is. In 2021, Carmel averaged about 96 medically related calls per month with a 90th percentile around 10 minutes. In November, the 90th percentile for the 90 calls is just above 9 minutes, and in December, the 90th percentile for 88 calls is 12 minutes, 1 second.
Oh, I
And
can
calls
hear what you're saying.
outside.
I am on mute, right? Good. I want him to hear what I'm saying.
I'm sorry. What?
Luce, did you have something, or was that you were unmuted?
I think it was like an accidental unmute. Okay, so yeah.
Yeah, go ahead, Roxanne.
Okay, so looking at Carmel Fire. Sorry, I lost my place for a second. So in Carmel Fire ambulance's responses outside of the fire designated response area. Again, there was an increase in responses in 2021 compared to the prior years with a total of 696 calls. The 90th percentile for calls outside of the CAD designated response area was around 11.5 minutes with an average of 58 calls per month. In November, Carmel responded to 51 calls with a 90th percentile just above 11 minutes. And in December, Carmel responded to 61 calls with a 90th percentile about 12 minutes and 39 seconds. Looking at calls within Carmel's CAD designated fire response area, the number of calls were lower than 2019 by just 24 calls, but it was higher than the 2020 total call volume. The 90th percentile response time was about 7.5 minutes for 2021. In November, for 39 calls, the 90th percentile was 5 minutes, and in December, there were 27 calls with a 90th percentile around 11 minutes. And again, because these lower call volumes do cause some variations, this slide should be interpreted with caution. And when looking specifically at Carmel by the Sea, which for this analysis, it is identified by the zip codes, by all zip codes within the city's limits. This included 25 medically related calls in November with a 4-minute 90th percentile response time and 4.5-minute 90th percentile with 20 medically related calls in December. And the November and December 90th percentile response time is relatively unchanged compared to all the prior months in 2021. That brings us to the end of my presentation. So thank you very much for your time.
Thank you. Does anybody have any questions for Roxanne? Seeing none, thank you, Roxanne, for that report. Now moving on to old business. I see none. Does anybody have any old business that we left off? I see no hands. We'll move on now to new business. Endorsing Carrie Catman as the SVMH Base Hospital Coordinator Representative to MAC. We need action on that.
I move we endorse him.
Harry
So-
moves to endorse him.
So,
Second.
Steve here. So yeah, just a little bit of background for this, based on our policy 1020 for the EMS committees. The appointment is by the EMS director, and it also involves basically a consultation with this body, the EMCC. So Carrie Campman is the new base hospital coordinator at SVMH. She is, if you've read the staff report, you'll see she's well qualified to be the base coordinator and to represent SVMH on this committee. And so, yes, we will need a motion and second and roll call endorsement.
Are there any more questions for Steve before I accept the second by Sam? I see none. Steve, Sam seconded it before you corrected
that.
me. So can I get a roll call, please?
Yes, Tina Nieto,
Aye.
Sam Klemick,
Got a thumbs up on Sam.
very good, thank you. Jim Landborg,
Aye.
Harry Robbins,
Aye.
Luz Garcia, thank you, Liz. Let's see, Nick Greenson,
I approve.
thank you. Carlos Spencer,
Aye.
John Anthony,
Aye.
Michael Esslinger,
Aye.
very good, thank you.
Thank you. That motion passes for endorsement. Moving on to endorsing Will Hiller as the ambulance contractor representative to EMS Operations Committee. Steve, any background on that one?
Will is now the operations manager for AMR and has been a member of our system as an EMT and paramedic for a number of years. And as you would see on the staff report from his brief bio, seems to be very well qualified and appointed with the concurrence of the EMCC by Teresa Rios to the EMS Operations Committee.
Move we endorse him.
Harry moved to endorse him. Could I get a second?
Thank you.
Second.
Mike Esslinger got the second in first. Could I get a roll call, please?
Okay, Tina Nieto,
Aye.
Sam Klemick,
Aye.
Jim Lamborg,
Aye.
Harry Robbins,
Aye.
Luz Garcia,
Aye.
thank you. Nick Greenson,
Aye.
Carlos Spencer,
Aye.
John Anthony,
Aye.
and Michael Esslinger.
Aye.
Perfect, thank you.
That motion passes unanimously. Now moving on to the nomination for the office of EMCC Chair and Vice Chair for this year.
Yes, this is necessary due to a change in personnel at AMR, vacating the office of chair. And if you're looking for nominations, that would be up to you, Tina, as chair.
I have a motion.
Harry, go ahead.
I move that we confirm Chief Tina Nieto as chair and appoint Jim Langford as vice chair.
And I'll accept the nomination. So Vice Chair was Jim Langford. Jim, do you accept the nomination?
Yes.
Any other nominations? Can I get a second on Harry's motion?
I second the motion.
Steve, John Anthony?
Got that, thank you.
All right, roll call, please.
All right, roll call, Tina Nieto.
No, I mean aye.
Don't do that to me. Sam Klemick,
Aye.
Jim Lamborg,
Aye.
Harry Robbins,
Aye.
Luz Garcia,
Aye.
Nick Greenson,
Aye.
Thank you. Carla Spencer,
Aye.
John Anthony,
Aye.
and Michael Essinger.
Aye.
Copy that. Motion looks like it carries. The only thing that didn't have the motion is when do you want it effective?
You let us know. Congratulations, Jim, by the way, so. All right, moving on now to the South County Ambulance Response Report. Kimberly?
Thank you. We're touching back on the subject surrounding an unusual occurrence report discussed at November's EMCC meeting regarding King City response times. The EMS agency wanted to look deeper than the reported instances, so we ran data on King City responses that occurred over 6 months. I have a small PowerPoint on the data we ran that I would like to present to the committee. So let me share my screen again. Can everyone see my screen? Thank you. Okay. So we ran all medicals in King City from June 1st to December 1st of 2021. There was a total of 483 combined priority 1, 2, and 3 responses. Out of those 483, 453 responses were compliant, which means the ambulance's response time was equal to or less than the response time requirement. And 30 responses were late. The ambulance's response time was greater than the response time requirement. So if you see the pie chart on the right-hand side, 94% compliance over those 483 responses. And on the bottom, there's a table just to kind of give a reference on the response time requirements, which King City falls into the yellow zone. And then on the next slide, it's just a breakdown of those total 483 responses. 63 were priority 1 responses, which is a code 3 lights and sirens non-divertible response. 283 were priority 2 responses, code 3 lights and sirens, which are divertible to a priority 1. And 137 priority 3 responses, which are code 2, no lights or sirens, and they are divertible to a priority 1 or 2 response. We ran the average of all of these responses combined, and the average response time across all priorities in King City was 8 minutes and 2 seconds. And again, if you look at the table, the most restrictive priority in yellow zone is 12 minutes. So it's quite a bit under for the average. And does anyone have any questions?
Actually, Kim, I do. First, thanks for doing that. And I guess I have a series of questions, and they all kind of come to a certain point. And I guess basically that point is, now that we see that you can do this, is this ascertaining this data for that geographic area? Is it difficult, or have you now created a model, a reporting model where you can do that? And where I'm going with this is, I think it would be interesting, you know, to either regionally, South County, North County, coastal, something like that. It would be really interesting to see what the data shows for the different areas of the county, rather than just clumping all green zones together, all yellow zones together. Because I think, particularly in the South County case, in Greenfield's case, you know, there's a unit posted 24/7 in Soledad, and one posted 24/7 in King City. And then we do get a unit during when staffing is available that does post during peak hours, but still, it would be interesting. It looks like the response times are good, but I think it would be interesting to know what's going on. And I'm sure that King City would like this on a regular basis. I'm sure that Soledad would be interested in this information on a regular basis. And I know that we would, and I would even venture to say that North County would also be interested in this. But just want to know how difficult it is for you to get this information and deliver it?
It's not super difficult. It's not necessarily just a click and it's not like a report that is, it's a little bit of manual work. It does take a little bit of time. Luckily, there were only 483 responses. I'm sure it probably depends on the time slice and how much we're looking at and the call volume in a certain area, how much time it would take, but we can discuss that and see what we can bring back.
Yeah, Chief, just to answer your question, that's one of the things when I talk about that the EMS agency is revamping, is looking at everything internally and see ways in which we can improve it. This is one of the areas that we're looking at. We've mentioned with different things that sometimes, just as Kimberly said, it is not as easy as a click of a button. A lot of the stuff that we do requires a lot of manual, data crunching. So it is something that we are discussing internally, so that we can see how we can provide reports, whether we rotate periodically to give reports per city or area. That's something that we need to discuss internally. But for us, we want to use data. The more that we use the data, I think that the more that we can find ways to improve the system and maybe find ways to make it more efficient.
Jim, some time ago, the Contract Compliance Committee looked very closely at the four Valley cities in the yellow zone because we were concerned about the clause in the contract about not having any underserved areas. And what I'd like to do under the Contract Compliance Committee is look at those four cities in the same context. I think we have the capacity to do that within the Contract Compliance Committee's mechanism. And if it is not too onerous and time-consuming of a task for staff to do that, let us give it a try and look at that. I still remain very concerned about the pockets and the four South County cities constitute four separate pockets. And I like to make absolutely sure that we are in fact giving them the service that they require. And I'm sure Teresa does too. I mean, this is something that's been discussed in several different ways. So let us look at that. Let's bring that back to the Contract Compliance Committee. That would be my recommendation at this point. If that satisfies your requirement, let's do it that way.
Harry, I think that your suggestion is very appropriate, that this belongs in the contract compliance. We will work with, the team will work on seeing how we can provide the reports and in the frequency based on how much data crunching we may have to do. This one wasn't so time consuming because it was only one area and it didn't, for a very limited period of time. But since we still have 3 positions vacant, we want to find best ways to approach this assignment. But yes, we definitely want to take a look, and I know, Harry, that this is an area that that is dear to near to you as far as the services in South County as it is to us. So we'll bring something back to contract compliance. Thank you.
And I wanted to turn it over to Sandra for just a moment. Sandra Flores, AMR's communications manager, because South County posting was discussed at the last EMCC. So I'm gonna let Sandra discuss that a little bit.
Jim, like you mentioned, we do have a 24-hour unit in King City and in Soledad. We do have a dynamic system in our deployment system in the sense of we do not just deploy for a city, we deploy for the entire Monterey County. So our system's constantly evolving based on, we receive a call, we fill, correct? Like, for instance, as soon as we get a call, we're constantly moving our ambulances to now serve that area that is now not being served. Regardless of the city, it's more the entire county and the area. So we're constantly shifting and moving ambulances, not just based on the city or one portion of the county, but the entire county. So as soon as that Soledad, King City, Salinas, Marina, Prunedale, any area gets a call, we're shifting those ambulances, posting location like Mike had mentioned early, to cover those areas. So we are constantly moving those ambulances, not for the next call, but to cover and protect the county and the system. So we're doing our best, constantly moving. Mike, I can go ahead and let you speak a little bit on that as well.
Yeah, and I think that those are all great points. I mean, essentially, you know, we're always trying to look at the system as a whole, and then, you know, of course, analyzing, you know, any significant calls that may have been, you know, an outlier. But, you know, we try to keep the main focus on the system and, you know, looking at ways that we can make improvements. One of the things I would like to point out is that the new the contract amendments that were made also provide some provisions that will help protect the 911 system. So while there will always be late calls and, you know, we'll always be reviewing those, there are some improvements that will help at least contribute or minimize a lot of the more delays I think that you would see in the system by protecting 911 resources for some of the IFT calls. So those are things I think it's always important to look at, but it is important to keep in mind that, you know, there's always going to be those that may come up where you have multiple calls, you know, drop in a more rural area. And even though they're, you know, as you look at King City, Greenfield, Soledad, you've got some more urban areas like in city centers, the travel time to get resources to those areas sometimes can be significant. So I think the contract committee, the contract compliance committee also is a great forum to, you know, do some further analysis, and we're always looking at ways that we can enhance the system as well. So thank you.
Yes, one thing, looking at the data as it was presented is very encouraging. I'm not alarmed at all about that data. I think it's responsive and it shows that the systems management process works.
Thank you.
All right, any more questions or comments? All right, thank you for that. Moving on now to AB 361. Steve, or?
I'm sorry, Chief Nieto, I think Devin had his hand up.
No, I'm sorry, Devin. I didn't mean to ignore you. Devin?
That's all right. Just something going forward. I know that Hunter Liggett's in the south, and I don't know if we can explore either a contract or something like that to utilize our ambulance too on and off post, if that might be something to minimize these long extended response times too.
Thank you, Devin. Anybody else? See no one, hearing no one, we'll move to AB 361 report requirements. Steve?
Yes, so EMS agency is recommending that the EMCC, you know, find that the requirements under AB 361, that there's a continued state of emergency and that remote meeting is in the best interest of the health and safety of everybody involved in the committee, as well as the guests and people who would like to show up. So this committee needs to find that those two things are in place as an item. And then also the EMS agency staff, because this body has to meet every 30 days to confirm the finding, in our next regular meetings not until March. EMS agency staff recommends that this body has a special meeting to determine that the AB 361 requirements continue, and we recommend February 9th for that meeting. So I would think that both of these action items can be done with a single motion, as long as we find that the requirements are in place and you'd like to meet on February 9th.
Can I get a motion?
I move that we find the situation in place and that we meet again on February the 9th, 2022.
Sam, do you have a comment or are you seconding?
Is there anything that precludes us from extending it beyond 30 days? I'm just trying to save us a meeting or two here.
Yes, the bill itself says it has to be done within 30 days.
Well, within 30, but it has to be for 30-day periods.
Yes, so if today we were to decide that the requirements are in place, we have 30 days, which allows us the meeting in February, but would not cover March, and therefore we would have to meet in person according to the Brown Act requirements, or if you met remotely, that would be also considered a meeting place and the general public could show up there. So yeah, it says 30 days, that's a hard stop. So it needs to be, a finding needs to be done every 30 days or less.
Second.
Chief Pansel, Holzer, do you have something? Excuse me.
I was just curious if, because I know some agencies do it as the first thing out of the chute at the beginning of their meeting, and then the rest of the meeting falls into that 30-day window, and that would preclude having, if you just did it first thing every meeting, then you would have the 30-day window open. I don't know if it has to, if that won't work, because that would save you the off-month meetings.
That would work, except that our meetings are 2 months apart, and the finding has to be every 30 days.
But does it have to be, my understanding is it has to, that it opens up a 30-day window, but that window can close and then you can reopen a new 30-day window, even though there might be a gap of time in between. I don't know. I mean, obviously you check with county council. And
yeah.
What they
so
say.
here's the issue. Let's say we didn't do a February meeting and we met in March. The fact that the finding hadn't been made within the 30 days, to start the meeting anywhere that people were meeting remotely would be considered a meeting site, and the public could join you there. So after that, you could exclude the public, under AB 361, but until then, they could join you.
Chief Holzer, County Council reported at the last meeting that unfortunately, when they drafted this bill, they did not consider bodies that don't meet monthly. So that's why we are in this situation where we have to hold a special meeting because our meetings are not monthly.
So it sounds like based on county council, we have to have the February 9th meeting if we're going to continue with Zoom. Is there any more discussion before I ask for the second?
Sam Clement gave a second earlier.
All right, can I get a roll call, please?
Roll call. Tina Nieto.
Aye.
Sam Clement. Jim Lamborg.
Aye.
Harry Robbins. Harry?
Aye.
Oh, great, thank you. Luz Garcia?
Aye.
Thank you. Nick Greenson?
Aye.
Carla Spencer?
Aye.
John Anthony?
Aye.
Michael Esslinger?
Aye.
Unless I missed somebody, thank you.
Thank you, Steve. So that passes. So just everybody, please just log on. It's a very quick meeting like we had just a couple weeks ago, so we can get quorum and just vote on it. Moving on to AB 389, Steve.
Yes. Oh, okay. So AB 389 presentation, this was something that was requested to have county council come back to this body, and we're not yet prepared for that presentation. We'll be scheduling that hopefully for the March EMCC meeting.
Thank you, Steve. Any questions? Seeing none, we now move on to announcements for the good of the order. Anybody have announcements or anything for the good of the order?
Chief, I have one thing very quickly here. It's apparent to me from the size of the packet and the agenda that we've got a lot going on here, which probably those in the response business, that's no surprise. What I deeply appreciate is the the challenges and that are offered by COVID, and the simple fact that as a discipline, we are learning and we're adapting and we're putting together some innovative solutions. That includes everybody on this call, on this board, and the staff. A lot of work here is done by staff, a lot of number crunching, a lot of effort. I think we need to acknowledge that. Keep up the good effort, folks, the citizens of Monterey County, all 400,000 of them. Deeply appreciate that.
Thank you, Harry, and I concur. This is not easy. So thank you guys for everything that you do every day. Any other comments or anything good for the good of the order? Seeing none, the next meeting we'll have is February 9th, just to be able to have the March 9th meeting. And Steve, you guys will be sending that out. I know we'll still be under the governor's order at that point, and we'll see how it goes. With that, could I get a motion for adjournment?
Make a motion to adjourn.
From Jim, second.
I'll second.
Michael Essinger did the second, Steve. With that, see everybody February 9th for a very short time, and then see everybody for the long time on March 9th. Have a great day, everybody.
Thank you, everybody.
Bye.